As a doctor, once patient is ruled for a procedure, something should be discussed between the patient and doctor before confirming appointment, such as his or her medical background, recent illnesses, current state of health, any drugs or supplement patient are taking, and any allergies, which in this case, patient is having an allergic reaction to contrast media. A form is given as a reminder and guidelines for the patient before going for the procedure, such as instructions where the day before the test, patient should drink clear liquid only. And since the patient has allergy to contrast media, she should be given a prednisolone to be taken 12 hours and 2 hours before the allocated appointment time. The risks and side effects should also be discussed before the form is signed by the patient.
Ms. Shasha Christina?
Yes.
When is your latest period? Is it last week?
Yes, correct.
Do you have any allergy to contrast media or any seafood and medication?
Yes.
Have you taken the prednisolone as prescribed?
Yes.
Okay, so today we will do cystography, which is an examination of your urinary bladder. Okay, so here is the consent form. You have to sign it here. So before we start, you have to change into hospital gown. Also, please ensure that there are no metal objects. Here is the changing room and here is the toilet. So you have to empty your bladder before the procedure.
Firstly, preset the exposure factor of 75 kVp and 35 mNs. Then, a 35 x 43 cm cassette is used to visualize region of interest. The cassette is placed in a lengthwise position. Next, start preparing for accessories such as 8 sponges. In this procedure, we use 45-degree sponge during oblique positioning to help in immobilizing patient. Next, center the X-ray tube with the table. The SID is set at 100 cm. Then, prepare radiation protection equipment such as thyroid shield.
May I know your full name and ID?
My name is Shasha Christina 1122.
Okay, please follow me.
Once the genital area is clean and in a sterile field, a catheter is inserted into the urethra. Contrast is administered retrogradely. The contrast is placed on an IV pole and utilizes gravity to help contrast flow into the bladder. Once cassette and beam are aligned, patient is positioned in posterior oblique position, where affected side are rotated 45 degrees to 60 degrees and aided with 8 sponges and covered in blanket for comfort and privacy.
The CR should be perpendicular to IR, centered 2 inches superior to symphysis pubis and 2 inches medial to ascis, collimate region of interest.
Breathe in, breathe out, breathe in, breathe out, and hold. Okay, so I will let you to do as we practice once I instruct you to do so. Okay, Shasha, breathe in, breathe out, breathe in, breathe out, hold. Okay, we have done the procedure. You may sit now. So after this, you can change and may need to urinate to empty your bladder before leaving, and you have to drink plenty of fluid to help flush out the contrast dye. Lastly, monitor your urine for a few days. If you have bleeding more than 3 days, do visit the ER ASAP.
Lastly, tidy up and sanitize the room for next patient.